Welcome to American Health 2012 podcast, Coalition Industry Update, Policy Threats and Opportunities, featuring John Camp, Executive Director. John, welcome to the podcast.
Thanks.
You have extensive knowledge and insights into the workings of Washington, D.C., and how politics are impacting healthcare and the industry overall. I'd love if you could address some of those hot topics, including the Sunshine Act, Supreme Court, taxes, and the FDA. And if we could start with the Sunshine Act and get your thoughts and insights, that would be fantastic. So why don't we get started, John?
Well, that sounds great. I'm going to do a quick little overview of who we are and what we do, but we'll get to the Sunshine Act very quickly. Essentially, most of the people are represented by the Coalition for Healthcare Communication if they work for one of the advertising agency groups or one of the major media in this space. The major members of the Coalition for Healthcare Communication are the big 5 agency networks, and you'll see from the slide that many other smaller companies are also now joining. Our mission is to promote, protect for society and individual patients the benefit of the free flow of healthcare information. And we have 3 passions. We believe that biopharma and device companies have a First Amendment right and a social responsibility to educate healthcare providers, doctors, and patients about their products. We believe that self-regulation is the hallmark of great communication, marketing, and education. We, in fact, believe that self-regulation trumps government regulation almost every time. And third, we think that communication and marketing and education are just as important as R&D. We think that, in fact, a pill is just a poison if it's not surrounded by the information that helps patients and doctors know when to take it and how to take it safely and effectively. The big 4 issues include the Sunshine Act. The one that keeps me up at night most every night is tax treatment of communication and marketing costs. But the second one is transparency, conflict of interest, collaboration, and Exhibit A about that is the Sunshine Act this year. Just quickly, we also are looking at privacy proposals that limit data use and communication to professionals. That's the IMS case that went to the Supreme Court last year. And privacy proposals, we shouldn't be following people online and serving ads related to what they're interested in and where they go. And then, of course, we always all worry about what's going on at the FDA and what they have in mind. On the macro business view, we're looking at all sorts of things that Washington is at the center of that are evolving our businesses very quickly. Washington didn't start most of these things, but it's accelerating them. First, let's just look at drug approvals. If there are no drug approvals, new drugs or new uses of old drugs, there's no reason for pharma, bio, and device companies to hire the marketing agencies that the coalition represents. Actually, last year, the freeze is off. The FDA is actually approving new drugs, devices, and bios. They're not the big drugs. No, the Lipitor drugs, the huge blockbusters appear to be over, or at least mostly over. And what's happened is the smaller drugs, the niche drugs, are now coming in to take their place. These are from smaller companies, smaller drugs. They're most often through accelerated approvals or the so-called orphan diseases. These are important, though. Some of these will become pretty big drugs, maybe not billion-dollar drugs, most of them, but they're important. Also pay attention to comparative effectiveness research. CER, as we call it in Washington, is all about patient-centered outcomes. There was $1 billion spent in the stimulus bill before the passage of the Affordable Care Act to fund these studies. More later in the Affordable Care Act itself. But what this is all about is the development of data about what is the most effective, particularly most cost-effective way to treat patients. Drugs is just part of that, not all of that, but we must be prepared to use these data. We must counter these data when they work against us. We must respond to these data. We must gather our own data. We must work very hard with the government and other payers to develop data that demonstrate the value of our products. Third, reimbursement, parallel reviews at FDA. Reimbursement now is just as important as approval. If you get a drug that isn't reimbursed, some people say it's not a drug at all. Competition is not just from other manufacturers of drug devices and bio, but it's against all other providers of healthcare services and products. You must understand that a lot of what's going on in Washington today has to do with money. Money, money, money. Also pay attention to electronic health records. Electronic health records are clearly going to magnify, speed the process of social media, internet media, communication, essentially develop more power in the patient. The limited government funds, the deficit, the national and state budgets are all driving the decision-making in Washington. Expect way more pressure on client pricing policies. Price, price, price. We're going to have to demonstrate value and price. The White House and Congress must do what Obama says, that is, bend the cost curve on Obamacare. Obamacare must do it or it will fail. At HHS CMS, the big word, the new word to me, maybe it's an old word to the rest of you, is capitation. And what that really is a discussion about bending the cost curve on healthcare delivery through pay for performance versus fee for service. And it's going to be pay for effective drug versus just paying for drugs. The value proposition of every drug must be proved. The good news about this is that adherence is just as important to payers, including the government, as it is to industry. And it'll start with our doing a better job of making sure that patients fill all the scripts they get and order renewals when appropriate. All about adherence. Some more on this macro business view. It is the era of consumer-centric healthcare. Doctors and providers are still going to be very important, no question about that. Formulary committees are going to be important, but what all of the new data available to patients, the internet availability of data at your fingertips in seconds, that's all giving the patients more power. Technology enables better coordination, better care, more patient control. FDA proposals for over-the-counter switches, pharma drugs to over-the-counters, and this possible new class of drugs are all part of this shift of power to the patients and other players in this business. They talk about conditions for safe use, but it's technology-driven, it's patient-driven, it's savings-driven. Over-the-counter drugs cost payers less, if anything, than pharma drugs, RX drugs. The consumer pays for OTCs. But just think about this third class of drugs idea that FDA is pushing forward right now. Essentially, if not all drugs require a script for a refill, which is one of the things they're talking about on conditions for safe use, it will change the power that patients have, put more power in patients' hands. The parties are lining up on all of this. Pharma is hanging back. AMA and AFP, the big doctor groups, are against it. And pharmacists, patient advocates favor it. Insurers and managed care are just salivating on this one. So let's look at healthcare reform. Maybe you start by the Supreme Court, which will decide sometime this month whether the Affordable Care Act is constitutional or not, particularly the mandate that everyone have insurance. I have a bold prediction. I think that the Affordable Care Act is going to be sustained. It's going to survive by at least 5 votes. There may be even 8 votes for it. I think there'll be some minor changes that they're tinkering that will happen in the court decision, but I don't think it's going to be overturned. Don't take me as the Bible on this one, because a lot of people disagree with me, but that's what I think is going to happen. The important part of this is I'm not sure it's going to matter. I'll take that up in just a moment. But the obvious prediction, there's nothing bold about this one, the court decision announcement is going to be the kickoff to intensify the whole Obamacare issue as a major election item. Expansion of care is going to be very popular among the voters. The cost of expansion is not clear. Many people are nervous about it. There are people who are going to use this case as a way to essentially take up even more clear sides for and against it. You predict, I don't know, will the Affordable Care Act survive the political changes in Congress in 2013? I don't know. Does the Supreme Court decision really matter for healthcare communication and marketing? I'm not so sure it's going to matter. Let's just look at the 3 political outcomes that are possible in this coming election. We could have a Republican sweep. In that case, the Affordable Care Act will be substantially repealed. But remember, Republicans seek broader coverage and cost containment and other savings in health care anyway. They're going to have to create a Republican alternative. Some ways it may not look all that different. In fact, if the health care reform is repealed, the same pressures that have been upon us for a long time will still be upon us. Pharma bio, device industry, and our marketing partners will all be faced with pressures for pricing, a push for generics and other savings on drugs, proposals to limit marketing, and a strong FDA enforcement policy by DDMAC, now OPDP. What if there's instead a close election where there's a divided Congress, where Obama or Romney is in the White House, but there's a very thin vote margin in both the House and Senate? If Obama's in the White House, it'll be the same people at HHS and FDA. If there's Romney is in the White House, there'll be somewhat different people. That will matter. But all of the other things above, pressure on pricing, push for generics, proposals to limit marketing, and strong FDA enforcement are going to happen no matter who is in the White House. Even if there's a Democratic sweep, it won't change pharma marketing all that much because there'll be an even greater push for universal coverage, lower costs, pressure on every sector, and again, going back to the top, pressure on pricing, push for generics, proposals to limit marketing, and strong FDA enforcement. It's all created, and the push is about Congress and the White House being constrained by debt in an era where everyone wants better coverage, more universal coverage. Politics may be more important than governing in the next several months in Washington. There's little agreement on anything, except maybe FDA funding. You may be watching, the PDUFA program is about to pass. It may even pass as early as July 4th. But there's no money for new programs, and many popular programs are going to be on essentially the chopping block, especially in the lame duck session. Be careful of lame ducks. They're erratic and unpredictable. A budget battle, which, remember the super committee? It was supposed to come up with all these great savings, and if it didn't, there were going to be these triggers, automatic cuts. In fact, they're draconian cuts in defense, taxes, tax cuts, and other things that really matter to people, like post office defense, entitlement programs. I'm not sure what's going to happen in that lame duck session, but taxes may rear their ugly heads again. Healthcare communication and the U.S. tax code continues to be very important. This is the one, as I said earlier, keeps me up at night. Medical marketing tax issue is not dead. It came up 3 times in healthcare reform. The Congressional Budget Office said that over 10 years, eliminating the tax deduction for marketing and education costs would save $37 billion. That's a lot of money even in Washington. But major tax legislation is more likely to be put off until after the election. There is a considerable agreement that the entire corporate tax code has to be changed to make us more competitive domestically and internationally. And so that's the changes that we're expecting, but not until after the election. Meanwhile, the Ad Tax Coalition that we work with very closely is focused on marketing, making friends, educating new leaders and new members, as well as staying close to the old members. Now, addressing much more directly the Sunshine Act, as you probably know by now, the enforcement policy, the need for companies to start gathering data has been put off for a year. The HHS, CMS units have put out a set of proposed rules. They're startling in some places. They're so optimistic about the ability of the government to do this and to do this effectively, and the entire industry has responded very directly. Our coalition comment on this says that HHS must do a much better job of ensuring that the data, when they're released, come out in a context where the press, the public, and public policy makers can understand the value of the collaborations behind it and the public health value of these physician collaborations. We also stand firmly directly with the AAFP and other physician groups that they must do a better job to ensure that at the very base these data are correct when they come out. The HHS's broad reading of the Sunshine provisions we think is unnecessary and counterproductive, and our primary exhibit on that is our objection to them interpreting the indirect payments provision. Essentially, those payments would not be reportable under what I think is the clear language of the Act. We think that the HHS rulemakers must go back and rethink their decisions about indirect payments. We also think the rules must be clear and definitive. There are areas of enforcement where we're going to have to comply that the HHS proposed rules did not even address. They're going to have to address them, and they're going to have to give us clear, definitive answers to some of the questions. We want to comply. We have to comply, but we can't comply unless you tell us exactly how to do it and what's done. We work very carefully with Congressman Rob Andrews, a Democrat from New Jersey, who helped, and Nancy Pelosi passed the Affordable Care Act, who wrote HHS and essentially made all of the points that we have been making in our comments. When will the final rules be out? I think sometimes by the end of this year. Now that the HHS has put off enforcement, some of the pressure is off to put these out immediately, but members of Congress, including Senator Cole and Senator Grassley, are putting pressure on them to move forward, so I assume they will. I want to just talk about a couple of other issues that are developing and continue to develop in the Congress. The PDUFA, the FDA funding bill, actually is passing. This is a great victory, actually, for us, because there are in none of the PDUFA bills, House and Senate and other proposals that are going to pass that will put more limits on marketing. This is the first time in the history of those bills. At the same time, DDMAC and OPDP, now the new name, OPDP, for DDMAC, has had a surge of enforcement against pharmaceutical company advertising and marketing and communication. And they've been very active in draft guidances. Coalition has been participating in multiple proposals. There's 2 proposals to even more strictly limit off-label communications. Some of that even has to do with social media, so we're getting at least a little social media guidance out of it. And there are 3 dockets on direct-to-consumer advertising. Not as important in our business as it once was, but still very important. At the same time, the FDA is doing very high-profile enforcement actions in the marketing area. And in the meantime, the social media guidance is sort of well behind us, and they're not moving very fast. At the same time, I also want you to make sure you're paying attention to the Federal Trade Commission and the Department of Commerce, who's developing new online privacy principles that will make it possibly, if we can't push back effectively, harder for us to follow people on the net and then deliver very targeted advertising. I want to do a really quick one on FDA Internet and social media policy. If you haven't seen them, the Coalition for Healthcare Communication and the Digital Health Coalition have put out a series of good practice principles. We're hoping the entire industry will coalesce around. We've talked to the FDA about them, and there seems to be a great interest there. We have seen just the first of the social media guidance in the context of some off-label issues. It's disappointed the industry, frankly, and it's disappointed me. But more importantly, there's more guidance coming. It's going to be important, but it's not going to be earth-shattering. You should understand that the FDA will continue to require full risk disclosure and balancing information. The FDA will clarify that if a company doesn't control a website, it's not responsible for it, and that, I think, will be very important. That's one of the things the Digital Health Coalition has been pushing very hard for, and we know they understand it, and we expect them to put out a notice accordingly. We also think, though, that company sites, social will be non-branded sites and apps only, pretty much what we have now. I don't see a great change on that. Real consumer engagement is going to have to continue to be on third-party sites, not sites that have direct company involvement, or at least not direct drug identification involvement. I think this is good for publishers. May not be good for the rest of us, but it is what it is. So, in summary, I just want to say a couple of things. The value of medical communication must be obvious to policymakers, patients, and to our doctor community. Patient care, patient care, patient care must be our focus. If we don't focus on patient care, if we're not better at helping people understand that we're part of the solution, not just expensive overhead, we can't win this fight to keep our business vibrant. We must be, and we must be seen as part of the solution to the delivery of effective, efficient, and, as much as possible, inexpensive health care. Without that, we cannot survive in this business. We're working very hard at the Coalition. I'm delighted that Pharma Voice have invited me to share this with you for a few minutes. This was the speed dating version of this. I'd much rather talk about it in some more detail, and I suspect we will do in this process.